979-1055 KISS FM. It is Listen, It's Liz. And on the phone lines, I have Dr. Cesare from Slocum Dickson Medical Group. Good morning. How are you?
Good morning. Good morning. How are you?
Oh, doing the best we can. And obviously, you guys over at Slocum Dickson have been very busy. SDMG.com in New Hartford. And how have things been going?
Well, I'm happy to say this week we just reopened the doors for a full day.
Love that.
We were operating at half a day, trying to mitigate, spread of any virus and putting into place all the precautions that we do with checkpoints and temperature checks. And now we mandate masks for everybody, and we're practicing the social distancing. So we're a pretty safe environment, I think, as best as we could be at this point. So we have opened up our doors, and now we're open till 5 every day.
I love that. And I mean, that is a good sign. And, Slocum Dickson, obviously you guys are making sure to keep not only the patients safe, but your staff safe. And the policy on wearing a mask, where do you guys stand with that?
Yes, I think that's probably one of the best measures that we have done and the country has adopted as well. We actually started doing the masks before it was mandated in New York State. And now everybody, obviously our staff and physicians, everybody wears a mask. And we require everybody that walks through the door to have a mask, and even the people that are accompanying them, if they have somebody with them, everybody has to go through the checkpoint. Everybody wears a mask. We've separated chairs in our waiting room for distancing. We put monitors in the hallways just to keep everything smooth and people not too close together.
Yeah.
And everybody's been great. I mean, patients have been great. Everybody's really adhering to the policies.
I think that with this COVID-19 coronavirus, obviously we've had to learn new ways to, do things and have things set up. And you guys have done this thing with telehealth, which I think is really cool. And for people who don't know what that is, what is that?
Yeah, the telehealth is a great modality. It's been around in the past, but really nobody's been utilizing it because, insurance companies wouldn't agree to it, wouldn't accept it, as far as a patient visit is concerned. But now we're able to either call you on the phone or have a video conference or appointment, if you will. So people can set up their regular appointments as a video or telehealth visit, and you actually see the doctor one-on-one or your practitioner, and can have a full visit. Obviously, there's no physical exam. We're not able to touch it through the screen. But for a lot of follow-up appointments, medication checks, things like that, renewals, just basic questions and concerns, telehealth has been a great vehicle to do this. And we're doing it quite readily. The insurance companies have accepted it. So, it's going to be part of our practice and medical practice in this country from here on out.
Right. And, with everything going on, being able to have that option of telehealth because other health concerns are still happening. Even though there is a virus out there, there are still appointments and stuff that you can't miss. And for those appointments that can't be done over telehealth, you guys are advising that it's only you who shows up for your appointments, correct?
Correct. We really want to limit it to the patient themselves, or if they need to, just one escort or one person or one helper or one friend, whatever it is. So just one accompanying person is the limit.
Yeah. And honestly, you guys are doing huge things for making sure that people feel safe when they are going and being looked at. And it's important that there is the social distancing, the masks, and all of these details you guys have been really active on your social media and also your website, keeping people up to date.
Yeah. We have a lot of signage to really help everybody understand. And things that people don't know that goes on behind the scenes, the sterilization procedures and the disinfecting procedures, they're done throughout the day. And we actually have a whole disinfecting crew that comes in at night as well.
Wow.
So we try to really prepare the place to be as safe as possible. We've tested our employees to make sure that everybody that you're seeing, basically at this point is almost everybody in the building has been tested negative for any virus, and even if people come in that are asymptomatic, I think the masks and the social distancing are really really works, and
Yeah.
I'm glad people have responded to that well. And I do commend our patients and our community for accepting that and practicing it because it does work and it's very good to do.
Yes, for sure. Slocum Dickson Medical Group, located on Burston Road in New Hartford, sdmg.com. You can see everything that they're doing, their new hours, and all of the policies if you are going to head there. And thank you so much for what you do. Obviously, this week we are thanking our nurses as well because it's National Nurses Day, and you guys, essential employees, making sure that we're running smoothly. And we can't thank you guys enough.
Well, thank you for having me this morning.
Of course. It's Dr. Cesare from Slocum Dickson Medical Group. More details about Slocum Dickson, head online, sdmg.com for more information.